Let's talk about some other chest pains that are in the same area. You mentioned several.
Well, I think another one to be very aware of is aortic dissection.
So the aorta is the big blood vessel that comes out of the heart?
Correct.
When you say dissection, what do you mean?
Dissection, so this is a little tear in the lining of the blood vessel. It's called the intima. Blood, and it's that when the heart squeezes, all that pressure goes into the aorta. So this is a high pressure system. So we get a little tear, blood dissects into that, and between it and the middle layer called the media, and each beat of that heart, that blood dissects further and further.
Whoa, that sounds like that life-threatening.
Life-threatening.
What are the symptoms?
It is, patients typically describe a ripping, tearing, acute onset pain.
So they'll have a tearing chest pain, typically.
Yes.
Again, anything within 6 feet can be the heart.
So, yes.
So pressure pain for the heart, tearing sensation, abdominal aortic, thoracic aortic dissection.
Yes.
So name me another one.
Yeah, to follow up on that, Dr. Bob, as that dissects through, well, there's branches off the aorta. Well, one of those is the carotid. So as it dissects, it can block that artery. So you might come in presenting with stroke-like symptoms, but really it was the dissection that led to that.
Whoa.
So it's very, very tricky. It's one you really have to, and a lot of those patients never even make it to the emergency room. They die before they make it there.